And what we're doing is different than what other people are doing. Other people are simulating the whole head or both sides, and we're simulating the positive hemisphere with the light. And with the new device, we're also inhibiting by pulsing slowly the light on the negative side, and that seems to be more effective. But when the patients get treated, they feel really different and feel better, and it's very gratifying. And so, we hope that we can bring it to market.
Welcome to OTR, Over the Rainbow, Achieving Mental Health for Real. This podcast offers hope to many people who needlessly suffer from mental health issues. Your host, Bob Adelman, brings you information on how you can recover from any mental health issue and achieve a happier life. If you want to know more, please check out his trailer. Bob's notes on today's show follows.
Join me as I talk with Dr. Fredric Schiffer about his new book, Goodbye Anxiety, Depression, Addiction, and PTSD. The life-changing science of dual brain psychology. Dr. Fredric Schiffer is a sought-after public speaker, best-selling author, psychiatrist, and part-time assistant professor at Harvard. The doctor believes that many mental issues originate from early traumas, and very often it's trauma that has not been recognized. Dr. Schiffer has discovered a technique to treat the troubled mind using something as unlikely as a piece of junk mail. This new book details the innovative new procedure to relieve the symptoms of these major mental issues.
Now, here's Bob with today's show.
Hello, Dr. Schiffer. How are you today? Welcome to OTR.
I'm well and very happy to be here.
Yeah, happy to have you. It's an honor. You've done a lot of work on anxiety, depression, addiction. And matter of fact, you have a book called Goodbye Anxiety, Depression, Addiction, and PTSD. So I will have to end my program. If everybody comes out and buys that book, they don't have to listen to me anymore. So it's called the dual brain psychology, which sounds interesting. I guess to start off first, I always ask my guests about their childhood to rate how they grew up. Was it normal, abusive, terrific? Because myself, I had a terrific upbringing, and then I hit a brick wall. When I hit adolescence, I got everything. I got OCD, ADHD really bad, dyslexia, depression, anxiety, severe depression. So how would you say your childhood was?
I would say that that my childhood was very difficult, and that I come out of a pretty dysfunctional family.
Right. So did you have symptoms of anxiety, depression right off the bat when you were a child?
I did. Yes. Yeah, I did. When I went to college, I had a lot of struggles and had a lot of therapy, so I went through a lot of difficulties myself. Yeah.
So did you know right away that you were going to get into this type of work and that you were going to get your doctorate?
No. In fact, I had a internship and residency in internal medicine, and I came to Harvard for a fellowship in cardiology.
Okay.
So I completed that and did. We had a couple of publications from that fellowship, and then I went from there into psychiatry. I was interested in cardiology and stress and heart disease. That was the focus of my research and my interest. And so to round out my education, I wanted to be sort of a psychocardiologist.
Okay.
I went to McLean Hospital for my psychiatric training, which is part of Harvard, and I went into psychiatry more thinking that I was going to work with cardiac patients.
Okay.
And then what I discovered was that there wasn't a market for it, that cardiologists and cardiac patients weren't interested in introspection. So I stayed at McLean as a attending psychiatrist. Got very, I became interested in the psychiatry piece and found it more interesting than medicine.
Right.
I found medicine to become kind of cookbook and boring after a while, whereas psychiatry, I feel, it's always invigorating,
Yes.
and I sort of do the same thing over and over, but it never loses its interest because it's a relationship and
Right.
working with people's souls.
Yeah.
Yeah.
It's great work that you do.
It is great work. Yeah, it's the best work I can think of.
I agree. So you make the bold statement, you have goodbye and crossed out anxiety, depression, addiction, PTSD. Now,
Right.
I don't know if you want to give away all your secrets, but exactly how, what is the process? You talk about the dual brain psychology. What is the process that you undergo to achieve this recovery, remission from depression?
Great question, and I can answer it.
Oh, great.
So when I was a young psychiatrist, I was interested in Freud, but as a young psychiatrist, I've always been, kind of interested in exploring things, and whether in cardiology or in psychiatry, and I was just noticing that I appreciated what Freud was saying about the ego and the id and the superego, but I realized that when I was dealing with my patients, it really didn't apply that way. In other words, I could sort of make it fit, but somebody didn't come in and I would talk to an id, but I did find that people seem to have two personalities. And one was when they came in and they were symptomatic and regressed and immature. And as they got better, they became a mature person. So they sort of went from an id, which was conscious, and Freud's id is unconscious. So you're not supposed to be able to talk to it. But I was talking to a person, in a kind of an id state, and then they become sort of an ego, and then they'd regress and they go back to this immature state. And then I was on a vacation with my wife and daughter in England, and I was rereading a book on the split brain studies. And these were studies that were done in the 1960s and won the Nobel Prize. And they operated on patients with intractable epilepsy. And so they really couldn't function in life. And so they did a radical surgery where they cut the connection between the left brain and the right brain. And the result was, and most people didn't understand this, but the real result was that when you cut the left brain, the connection between the left brain and the right brain, you had two different people. One hand wanted to smoke, and the other hand kept putting the cigarettes out.
Wow.
Another woman, she wanted to put on a dress, and she's buttoning it, and her other hand is unbuttoning it.
Wow.
And each hand is controlled by a different hemisphere.
Right.
One guy was married, and his wife just couldn't take all his medical problems and left him. Mm-hmm. And so he's trying to he moved out and got another apartment, and he's trying to go home to his apartment, but his left leg, controlled by his right brain, kept walking in another direction, and the surgeon understood that the left leg was trying to walk to where his wife was.
Wow.
and so I did a split brain study. I did the last study with the California series, which won the Nobel Prize, and what I did was the first psychiatric interview of each hemisphere, and I would ask, how much do you feel? And a different word would come up on each side of the screen and would be seen only by one brain, left brain or right brain, depending on which side of the screen it was on. And so and what we found was that so the words that came up on the screen were opposite, but they were like how you feel. So it might be happy and unhappy. And there were like 24 word pairs, and they rotated. And in one patient, his right brain had a very high opinion of himself, and his left brain had a low opinion of himself. And another guy had sort of similar opinions of himself, but when we were setting up the equipment, he told me that he had been bullied as a child. And so I placed about 10 bully questions, just interjected them myself. And the questions were, all of it was kind of the order, how upset were you by the bullies in different ways. And all of these questions, which are answered by is pointing to pegs with one hand or the other, which is attached to either the left brain or right brain. And his left hand, which is signing for his right brain, which can't speak, said that he was extremely upset by the bully, whereas by the bullies, and whereas his right hand, which is signing for his speaking left brain, said he was not upset by the bullies, as he told me. And so the way we interpreted that was that his left brain was not upset by the bullies, but his right brain was still very upset by the bullies all these years later. And so later, I through a German group that was showing movies to normal people, to one side of the brain, or one side of the head or the other, was able to get different emotional responses, depending on which side it was shown to. And so this is where the envelope came up. So I figured they had this very complicated $1 million machine, and I realized that I could do the same thing with an envelope or hands, so it turns out that the eyes are connected to the brain, such that if you look out the lateral half of one eye, and actually you can try this if you like.
Okay.
Do you have an envelope handy?
Yeah, how about my hand? Would that work? Or I need an envelope?
You can use your hand, sure.
Yeah,
so,
I got to
so
cover.
Maybe, so close your right eye,
okay.
and with your hand cover the middle of your left eye. So you're looking out the lateral half of your left eye.
Right, got it. I'm there.
Okay, and I want you to think of maybe that trauma that you mentioned.
Okay,
a brick wall.
Yes.
And I want you to see how much distress you feel from 0 to 10.
I would say about 5 or 6. Not too bad.
Okay. Now I want you to close your left eye.
Okay.
And look out the right half of your right eye. So the lateral half of your right eye.
Okay. Okay. All right. Yeah. I
And
got it.
how much distress do you feel?
A little bit more. A little bit more.
And how would you rate it? What number would you give?
Maybe a 7.
Okay, so how many points higher?
Like a 2 points. One was 5. The other one would be about 7. I felt a little bit more tension.
Yeah. Well, that's this is. So what you're doing is by looking out just with an envelope, the lateral half of one eye, you actually stimulate the opposite brain hemisphere.
Okay.
And so this would mean that your trauma is more situated in your left brain, because when you look to the right, it feels a little worse.
Right.
And so in dual brain psychology, I talk. I'll have you look out the right side, and I'll talk to the little boy over there who feels more traumatized, and you come to understand how he feels about. Both sides are upset by it, but one side is more upset, and the fact that you can feel less stress or less distress looking at your left side means your right brain is not as affected, not quite as affected by it. We can use that to enlist your healthier brain to be sort of a co-therapist.
Okay.
And showing your more troubled side that, well, it was bad, but I can handle it.
Gotcha.
And so this helps to understand the problem, and that it's coming from sort of an inner child on one side.
Yeah.
That's in one brain hemisphere.
When I was growing up, my mother said to me that my brother, who's a year older, used to knock me down all the time. When I was trying to walk, he'd knock me down. I was bullied at 1.
Right. Right.
So I think probably that's where it started, but ADHD was in, my mother had it, and she was undiagnosed, but she had it. And so I got a whole laundry list of traumas, I guess you could call them, including the trauma of I guess you would call it a nervous breakdown. At one point I just fell apart. So
right.
If this is my condition, how will this book help me?
Well, first you have to read it. So what the book has is a number of narrative fictional therapy sessions. So they're accurate to the individuals, and they're accurate descriptions of the actual therapy sessions. And so you can see how I sort of talk to one side or the other.
Okay.
One of the patients in the book, his father would come in his room and just without any reason punch the hell out of him. When he looked at his negative side, he sobbed and could talk about the terror of that. And then he'd look out the other side, and he was an executive, fine, and he could handle it. And so it helped him to understand that there was a lot of pain in him, and that he felt rejected and terrified and was carrying that with him in part of him, and so by kind of bringing that out and talking about it and having him bear that trauma and having his healthier side help him. In other words, instead of what happens is that the two minds kind of fight with each other, and they try and suppress each other.
Gotcha.
and they're trying to kill each other. So I try and get them to cooperate and love each other and help each other,
Right.
and have compassion.
In my case, when I went to work, I was respected. I did IT. So I did it well. They respected me there. Then I would go home to my family of origin, let's say for Christmas. And I was treated like a baby and no one listened to me. To this day,
Right.
my brothers treat me like I'm a nothing. I'll say something, they won't even recognize me. So
Now what that does is, there was a movie with Steve Martin and Lily Tomlin. And in the movie, Lily Tomlin's with her guru, meditating, and there's a terrible accident. And that is that the humming bowl slipped out of the guru's hands and tumbled down a tall set of stairs in Manhattan. And because of this terrible accident, Lily Tomlin's mind got embedded in Steve Martin's brain.
Okay, I think I did see that. Yes.
Okay, it's called The Two of Us.
Yeah.
And so this is really what it's like in normal people.
We're fighting each
it's
other.
Exaggerated in the movie, but so that what happens is when you visit home, it stimulates Lily Tomlin,
right,
and gets her going.
Right.
Come on, Lily, and so you regress. And feel like a child is being abused and ridiculed, and then you go back home, and the people who love and appreciate you, and that kind of stimulates your more mature side.
Right.
And that these two personalities are affected by outside events. And not only that, but sometimes one side just dominates all the time. It might be using drugs and really regressed, and it won't let the healthy side come out. A lot of my patients don't realize that they have a healthy side.
Yeah. I just feel that in my personality, I either have to dominate or submit. I don't know how to do peer or groups on an equal process. Either you dominate me or I dominate you. So
yeah, well, I think that's acting out your trauma. In other words, that you want to dominate so you don't get bullied.
Right.
But the little boy in you is anticipating being dominated, and so you sort of go between Lily Tomlin and Steve Martin. You're just kind of bouncing around.
Yeah. So the one thing I heard what you were saying is you use infrared technology. Can you expand on that?
Right. Yes. So I was looking for a stronger way to stimulate the healthier hemisphere, and I knew that near infrared light, which is the kind of light that you turn on your TV with, goes through the skull, and that there's for instance, when you go to the doctor and he puts a thing on your finger to read your oxygen level, that there are similar devices that use the same technology on your head, and light goes into your head, and it measures your oxygen in your brain, and you can use that also to just manipulate the formula, and you can measure the blood flow in the brain, and these are used in ICUs. Someone had a stroke or something, and put these monitors on their brain, and so they're actually commercially used and accurate, and so I had used that. We purchased a device at McLean at Harvard and I was using it in studies. I knew something about near-infrared light, and so I just made a cold call to Mass General Hospital in Boston. It's part of Harvard, and Mass General and McLean kind of have a joint residency program now, and so they have a Wellman Center for Photo Medicine, and so I just made a cold call, and I got kind of pushed around, transferred around to different people, and so there's one guy who was quite interested, and I wanted to know whether it would be safe to do, and the answer I got was that if it doesn't hurt the skin, it won't hurt the brain, because the power of the light diminishes with the distance by the square.
Right. I interviewed a fellow, Dr. Henderson, Theodore Henderson, and
I don't know.
He's out in Colorado. He does this kind of infrared therapy,
right?
And he says it almost always works. He says, he gets rid of the anxiety and depression and sends them home. You're not depressed anymore. So I've been hearing a lot about that.
Right. It's called photobiomodulation. Mm-hmm. And so I worked with MGH, with this guy who turned out is a leader is the world's authority on photobiomodulation. And we developed a device, and we did the first study for depression and anxiety on the head using this light. And so, today there are a number of people who follow that up, and we got really some remarkable results. But what I was really interested in was applying this light over the positive hemisphere.
Right.
And so I use it to stimulate the positive hemisphere, and it's remarkably effective.
Wow. Something about neuroplasticity is diminished on part of the brain. Have you heard of that?
In terms of the mechanism of this, I think it's a little different. In other words, when you looked out one lateral visual field or the other, you felt differently within seconds.
Right.
Am I right?
Yes.
Okay. So you're talking about neuroplasticity.
Right. I probably mispronounced it.
And that's the growth of neurons, and that doesn't occur immediately. I don't know that.
It was a long process, like once a week for 6 weeks.
Yeah, but even that, it's sort of. I don't think it's clear how quickly that works.
Gotcha.
Or at least I don't have a good answer for it, except that
no problem.
It's not something that's going to happen in seconds.
Right, exactly.
And so I think that the mechanism of action here is that the light, which is energy, that goes into the brain and gets absorbed by the brain, I think stimulates a mind. And in other words, the brain is an information processor, and each brain hemisphere has different information. One brain feels in danger and traumatized, and it's thinking more like a child that's in danger. And if you stimulate it, then the mind becomes that of a child who's in danger. If you stimulate the other side, you get a different personality, and it's a person who becomes an executive and can is not as troubled by the trauma, recognizes the trauma, doesn't like it, but he can bear it, and So I think that there are certain quantum effects, that the light is transforming the brain information into an experience, and that that what's really happening is that the light is creating an experience from the brain information, and the experience can either be negative or positive depending on which side you're stimulating.
Right.
Now
have you done this on certain people, or?
Yeah, I do it all the time.
Okay.
And we're running a study right now treating fentanyl addiction, and we don't know who's getting sham and who's getting active, but about half of the people are doing very well, and about half are not doing well.
Okay.
And so we're hoping, for the success of our experiment, that the people who are doing well are getting the active treatment. Now, these are people who are either coming off of fentanyl or coming down about 90% of their dose, and with just a light treatment, no therapy.
Mm-hmm.
And I also just completed a study using a new device that stimulates one side and inhibits the other. And that device we just got a patent for, and
what do you call it? What's it called?
Well, it doesn't really have a name yet.
Okay.
It's not marketed because we're going through the FDA, and we have to get FDA approval.
Gotcha.
And so if the results from this fentanyl study are positive, then we hope that we'll get FDA approval and be able to bring it to market.
Nice.
And the new device that we have, we'll have to go back through the FDA and get approval for that. But I used it in my in a study for depression, and just one treatment got a 65% decrease in the depression score with the novel device. The device that we're using in this current study got a 40% reduction, and the placebos got about a 30% reduction in depression with just one treatment per session, and so that both the active treatments were significantly better than the placebos, and the novel treatment was much better than the original treatment. And so we're looking forward to having more studies. But we've done a few studies for depression, and what we're doing is different than what other people are doing. Other people are stimulating the whole head or both sides, and we're stimulating the positive hemisphere with the light, and with the new device, we're also inhibiting by pulsing slowly the light on the negative side, and that seems to be more effective. But when the patients get treated, they feel really different and feel better.
Right.
And it's very gratifying.
Yeah, I mean, that's terrific.
So we hope that we can bring it to market.
Now, if somebody wanted to get involved with this technology, what would they do? They read the book, and then where do they go from there? Are there doctors that are doing similar things?
Well, it isn't available. There are a lot of you can get a lot of near-infrared lights on the internet, but most of them, or all the ones that I've encountered, don't do anything. And the results that are published by other researchers. They stimulate both sides, and their results are not as good as the results that I've been getting. Yeah. And we haven't seen any side effects to date, and I've been using it for 15 years. But the FDA wants to be sure of that, but it seems, and in the literature with other people, it seems to be very safe, and I think, you know, compared to like SSRIs, I think it's much more effective. So what is effective is the light. So we have a metallic sticky that we put over the sham device, and what that does is it allows for some warmth to come through, so that the patient, so it feels the same as the active device, but they don't get any light. They don't get any photons.
Okay, by sham you mean it's a placebo?
It's a placebo,
okay.
Right?
Yeah.
And so in our studies we compare the active treatment with a placebo device.
Okay, and what were the percentages of success?
Well, in the current study, we don't know yet, okay, because we don't know if the people who are getting better are getting the active treatment.
Okay.
But a lot of people are getting better.
Okay.
And about half aren't, are anticipating that they're getting sham, but we don't know that.
I got you.
And we have to get the results. But in our phase 1 study, where we were just studying cravings, not use.
Okay.
What we found was that the active treatment, given over twice a week for 4 weeks, resulted in a 72% decrease in cravings in the active treatment and a 35% decrease in the sham group.
Okay.
And that was statistically a huge difference.
Yeah, that's a lot. Yeah, but I imagine if it all works, a lot of psychiatrists and doctors will get it. You know.
That's right. That's what we're hoping. Yeah.
Okay.
We're hoping actually that we change the field.
That'd be terrific.
And also that it gets integrated with dual brain psychology.
Okay.
And that if I have a patient in my office and we're working with the envelope, or I have sunglasses that have a similar effect.
Yeah, they're on the cover of your book, right?
Right.
Okay.
And then we're working on some others that are just wellness devices, wellness glasses, so what I want to do is to combine it all. The dual brain psychotherapy, where we're talking to two different people and one person,
right.
And using the envelope with the sunglasses, and also using the photobiomodulation or the near infrared light, and so you know, maybe we'll have clinics and be able to really treat people properly.
That's great. I mean, the name of my show is For Real, so I always ask about how do we really do this, but that makes sense. We got to wait.
Yeah, unfortunately, I have to wait too. You know, we're all waiting. But the FDA is they've given me a breakthrough designation, which means that they're, you know, trying to expedite it and they're advising us so I think that, you know, they would like to see us succeed. But of course, we have to also analyze the data and you know, confirm that it's working the way we hope.
Well, I hope it works out. I mean, that would be tremendous for, you know, especially the hard cases that don't react to SSRIs. So
and if a person feels good after the light treatment, and if they feel really well, it opens a window.
Mm-hmm.
It's like someone who just felt despair and hopeless, and it lasts about 3 days, so it's not like it's a permanent cure. But if they got treated twice a week, it would be better than SSRIs, the Prozac type drugs.
Right.
But but I think it would be better in conjunction with talking and having an understanding of the trauma and how to bear and grieve and get the two sides to work together.
It definitely brings what I want to bring out in this show is hope. Somebody that's really bad wants to do something.
That's right.
Yeah, he now has hope.
Yeah.
To hold on and wait for these things to come out because they're right around the corner. So, in a year's time, we might see this happening. So that would be really good. And that's why I put you on the show, because I know how important this could be.
It is. It's urgent. And we're the study with the FDA is for opioid addiction, which turns out is just fentanyl today. There's nothing else out there.
Right.
And so if we get approval for that, then we'll go back and try and get approval for anxiety and depression and PTSD and addiction, and other addictions. But in my private practice where I do studies, I know that it's effective.
That's good.
For these other indications,
Well,
I say that I don't have FDA approval, and it has not been explored by the FDA, and but in papers that studies that we've published, again, it's not FDA approved. I want to emphasize that for depression or anxiety or PTSD. But we're hopeful.
Right. Do you have any links that you'd want to read out? Or
yes, yeah. I have a website that has a lot of information on it and has a number of my papers and has a link to my books. I have another book that has a couple of editions called Of Two Minds, and so the website is dualbrainpsychology.com with no punctuation. Just dual brain psychology, one long word.
Mm-hmm. Okay. I mean, I'm very glad I got you on, and this looks like a very promising future for people that are suffering so badly like I did.
That's the intent. That's the intent. Yeah.
You were excellent, and I really appreciate you coming on the show and helping everybody out.
Well, thank you.
I appreciate what you do to help people, because it's great, and we need more of it. Yeah.
Thank you.
All right. Take care.
Thank you. Yeah, and I appreciate talking to you.
Take care.
Thank
Bye-bye.
you.